Welcome to the Advancing the Kingdom podcast. We are streaming live on all social media platforms and podcast streaming channels. Get ready for a revelatory teaching from our apostle, Matthew Tillery.
Well, greetings. Thank you so much for tuning in to the Advancing the Kingdom podcast. I am your host, Apostle Matt Tillery. Listen, it's an honor that you have chose to be on the live tonight and be a part of this conversation tonight. So we really appreciate you. We are a couple of minutes late, but hey, we're still good to go. Listen, we're going to continue a conversation on mental health that we had last month with Dr. Tiffany Tyson. She's a board-certified psychiatric and family nurse practitioner. She's also an author and a wellness advocate. Dr. Tyson received her Bachelor of Science degree in nursing from Barton College in Wilson, North Carolina. She has a Master of Science degree, family nurse practitioner at Duke University, and a clinical doctorate in mental health at Robert Morris University. Listen, we are honored to have her on the podcast tonight. Thank you so much for coming back on the podcast.
Thank you so much for being here.
How are you feeling tonight?
I'm doing well. Ready for our conversation because it's always great to be here. It feels like we're family just having a conversation.
That's going to be a great conversation, and just really excited and very grateful that you come back on and share about mental health, because certainly the times that we're in, a lot of people are stressed out and we don't know why we are stressed and so forth and so on. So, but tonight we're going to talk about is it stress, depression, or hormones? Because hormones affect mental health by changing the chemicals in the brain, right?
That is correct.
So there is something called perimenopause in women. Talk about that. Or what is it, and what age can actually begin that we can begin to see that manifest, and why is this conversation so needed at this time?
That's a great question. I'm going to tell you a funny story, because we talked about, is it stress, depression, or perimenopause? So a few weeks ago, I was actually getting ready for work, and I went out to the car, and I noticed I did not have my keys. And so I dashed back into the house because I didn't want to be late. I looked on the countertop. They were not there. I went in the bedroom. They were not there. So then I just emptied out my purse on the sofa. The keys were not there. And then I remembered that, I left my water bottle in the refrigerator. So I opened the refrigerator up, and guess what? There were my keys beside the water bottle. And I said, okay, this could happen to anyone. I laughed at myself, and I said, okay, you may need to slow down, because, as busy women and men that we are, we're church leaders, we're bosses, we're employees, but sometimes we gotta slow down. So that was my reminder that day that I need to slow down a little bit.
Well, maybe I need to slow down because I lose my keys all the time. So how does a woman know if what she is experiencing, is it stress, depression, anxiety, or could it be the perimenopause?
So sometimes we don't know, and that's why it's so important to get a good history when the woman comes into the office. When I say get a good history, ask those questions like, okay, how many hours are you sleeping at night? Have you had any major stressors that are occurring right now in your life? When was that last menstrual cycle? And then, are you eating well? Are you eating a balanced diet? Because sometimes, if we're not eating balanced diets, we can get a little bit off as well. Right. And then, are you sleeping 6 to 8 hours, or are you barely sleeping? And then after those questions, also ask about family history. Sometimes it's important to have that conversation about, when did your mom have menopause or perimenopause? So that's a very important question there. But then sometimes you might have to delve a little bit further and check out some labs. So now estrogen, when we're talking about perimenopause, this is where your estrogen level is fluctuating. Some days it may be high, some days it may be low. So sometimes you can do those labs, but you don't know if it's on a high or low day. So that cannot be diagnostic. So you may want to dig deep and say, okay, let's check your thyroid level, because sometimes thyroid, whether it's overactive or underactive, can cause weight gain, weight loss. It can cause irritability. It can cause issues with sleep, body temperature regulation. And so you want to look at that. But then also, are they anemic? Because sometimes
Right.
you can have low iron, and low iron can make you have brain fog or you can't concentrate on that day. And so you also want to look at vitamin deficiency. So vitamin D, B12, or does this person have another medical thing that's going on? Do they have uncontrolled diabetes? But let me back up because you asked what was perimenopause. So perimenopause is actually a transition. So sometimes individuals think that menopause just automatically happens one day. And so that's not. So menopause is when you've had gone without a cycle for at least 12 consecutive months. But before the menopause, there comes peri. So peri's like that transitional period. And it can happen within women when they're even in their late 30s, their 40s. Perimenopause can last from 4 to 10 years before a woman actually reaches menopause.
Oh, wow. So can a person, can you have stress, depression, anxiety, and all of it at one time?
You can have all of it at one time.
I think I met a person the other day that had all of those things.
So that's why you got to tease it out. You got to ask those pertinent questions during the visit to figure out, okay, what is this exactly?
Wow. So what symptoms surprise women the most?
Well, when people hear perimenopause or menopause, they think of hot flashes. And not every woman experiences hot flashes. Just because your mom or your grandmother or your sister had hot flashes doesn't mean you're going to have hot flashes. So you may be like, you're wondering why, okay, you're watching that commercial and all of a sudden you start crying.
Right. Yeah.
And you're like, why am I crying over this commercial with the dogs in the commercial? Or you might have night sweats, or you're wondering, okay, you're waking up at 2 and 3 o'clock in the morning. So that could be happening as well. Or you could be irritable. So, and then sometimes, like you said earlier, these things can overlap. So that's why you got to really get that good history, because sometimes irritability, not sleeping at night, anxiety, sometimes it can all be related with anxiety, stress, or perimenopause.
Wow. So let's say someone is listening tonight and they're saying what you said so far is actually describing me. What is the first step they should take?
Don't panic. Don't panic. Don't get anxious. Don't say, oh my God, is this what happens when you get older? So don't do that. But you want to just, again, think about the symptoms that you're having. How long have these symptoms been going on? And so you want to start keeping some notes so that way you can kind of prepare or plan when you go see your primary care or the OBGYN, because they're going to ask pertinent questions and you want to be ready to provide the answers about how long have the symptoms been going on. Are you having hot flashes? Are you having night sweats? Are you waking up at 2 in the morning? Are you noticing that your menstrual cycle is changing?
Wow. So I guess the next question is, how can we as men be more supportive in a woman's life when they are dealing with that? What can we do as men to be more supportive? Will flowers work? More flowers? Will that work?
Sometimes it does, but sometimes just listening, because I know sometimes men like to jump in and fix it. And, sometimes women like things to be fixed, but sometimes we want just the male in our life to just sit down and just listen to what we're dealing with. Don't be judgmental. Don't blame, but just, communicate. You like, I've noticed lately you don't seem like yourself. How are you feeling today? And then be supportive. They may want, you to go with to their doctor's appointment.
Wow. So we also have some hormonal things happening as well, right?
Let's get on the men now.
So what are some of those drivers that can affect a man's mental health?
So women have estrogen, men have testosterone. So also when testosterone is lowering, which that can happen as well, sometimes in the late 30s, the 40s. So same symptoms, men. Sometimes you guys can have mood swings, irritability. Sometimes men can also have brittle bones. Sometimes men and women notice that there's that gain in that middle section. and sometimes they can have mood swings. So it's the same similar symptoms that
Right.
women have as their estrogen is fluctuating.
So are there any physical symptoms like fatigue or weight
Yes,
changes?
fatigue, weight changes, again, especially in that midsection. Lack of energy, yes, definitely.
So I guess what are some of the things? Is there anything required to do, or you just deal with it?
Well, I would say as a couple, you want to communicate because, both of you guys may be going through changes. I would say be patient with one another. Again, not blaming, getting that exercise in, going for walks and things like that, and making sure that you both are eating very, very healthy.
Right. So what is hormone therapy? What is that?
So sometimes it depends on, and sometimes it's going to be very controversial about whether women or men need hormone therapy. And so again, you got to go back to that history because sometimes individuals may not need hormone therapy. Depends on if we're talking about women, if they've had a hysterectomy or not had a hysterectomy. But you also want to know, do they have a history of blood clots or breast cancer? And so this is where that getting that good history comes in when you're meeting with your OBGYN. Sometimes, there's choices whether you want pills or patches or creams. And so that's the important dialogue that you're going to have with your OBGYN or your primary care provider.
Right. Is that the answer for everyone? Is that
Is what the answer for everyone?
the hormone therapy?
No, that's not the answer. Again, you have to meet with your provider and decide together because at the end of the day, guess what? Men know more about their body. The women's coming in know more about their body. And so the medical provider is the expert, but it's a collaborative approach and deciding if this is what fits for you based off of because you may come in and say, hey, I'm having mood swings. Can you help me with that? Or I'm having hot flashes. So it depends on what's really happening at the moment.
Right. And, we live in a very stressful time. If we stay focused on what's happening with the news and social media and all that stuff, and you talked some about it last month, with all the things that's happening, what are some of the things that, and I know you mentioned it last month, but what are some of the things that we can do in terms or to help eliminate some of the stress that we kind of, like if I'm on social media all day, right?
Mm-hmm.
Then that could, and just seeing all the negative things up there, or I'm just watching news all day. Those things are contributors, right, to my stress level.
Mm-hmm.
So how do I manage that? I know one of the things you can get off social media, right?
Yes.
So some of the things we can do to manage it, and you talked about the hormone therapy in terms of the other stuff, but what would you say to the person that's in terms of what's happening with all of the news all over the world, with everything that we're seeing happen in the earth now? What would you say to the person or persons that's saying, I'm at my wit's end, if you will, and I'm just really frustrated right now. I don't know what to do right now. What would be some encouraging words for that person tonight?
Well, as you mentioned, sometimes we got to pause from social media. Like we talked about last time, sometimes people have a fear of FOMO, fear of missing out. Like, again, why don't I have this car? Why didn't I go on this vacation? So you really have to do, I call it a detox from social media or a pause from social media. And that may vary. You may need a break for a week, 2 weeks, and focus on you. Or, not watching the news every day. We talked about sometimes the news may repeat. You may see the same thing at 6 o'clock that you saw at 12. But then also hanging around people that bring you peace.
Right.
Because sometimes certain people stress you out. So hanging around people that bring you peace. And then going back to self-care.
So what would make what would make a person want to continue to hang around people that every day are just constantly causing more stress, and it just keeps adding up? Because after a while, something's going to happen if you just keep building up, right?
That is correct. But sometimes I'm like, okay, this person's been in my life for years. Or sometimes you got to let them know, hey, I'm dealing with something today. Let's talk about something else. Because sometimes you have people that connect with you. And every time you pick up their phone, they're always talking about some drama.
Right.
And sometimes you may not want to hear their drama because you're dealing with your own drama that day. So you may need to say, hey sis, or hey bro, let's get together next week, or let's talk about this next week. I'm headed to do such and such, or let's pray about it. Because we gotta, at the end of the day, we gotta pray about everything and worry about nothing, right? So sometimes you gotta bring prayer in there. Sometimes you need to quote some scriptures, or because again, they may be going through, but you may not be able to handle what they're dealing with because, like you said earlier, you're dealing with your own stressors.
And you can't be a fixer for everyone.
You can't be a fixer for everyone.
Wow. So, I mean, you are a doctor, and you certainly deal with mental health each day, every day. But with your personal life, when things are beginning to mount up and you feel like you're against the wall, what are some of the things that you personally do to just kind of say, I need to step back for a moment?
That's when you go on vacation.
For 2 weeks, right?
Yeah.
3 weeks.
So you take time to go on vacation, and just go. Sometimes I like to go where there's water because something about the water is very calming. You're watching the waves as they go in and go out. And prayer. Sometimes getting in your own secret closet and just having prayer. I believe in prayer. Matter of fact, I do devotion every morning because I never know what I'm going to face when I get out there on the road on my way to work. So I have to pump myself up for the day. So I'm listening to my, either I'm reading or I'm listening to something that's spiritual, that's inspirational,
right,
to get my day started, making sure that I'm eating nutritious foods. So if you guys are listening, make sure that you're eating foods that are the color of the rainbow. What do I mean? You should have green leafy vegetables also, but carrots and blueberries, strawberries. So make sure you're eating the rainbow, oranges. Steak. That's protein, but so women and men need protein, especially if they're going through that decline with estrogen and testosterone. So protein helps with muscle, it helps with energy, it helps with fatigue, but also those fruits and vegetables are going to help with antioxidants and the vitamins that you need. And then I have to also make sure I'm getting enough sleep. Right. Sometimes I may be guilty. I'm up, doing notes or whatever, it's late, because people automatically assume that, oh, okay, she's finished seeing patients today, she has nothing else to do, but I may be up late working on notes. So I have to make sure that I'm getting enough sleep for the next day as well. And then I have to make sure that I'm drinking my water. She just brought me some water. So I have to make sure that I'm hydrating, right, because that's important, because sometimes we can be dehydrated.
What are some of those things that can cause you to not get the 6 to 8 hours of sleep we need each night? What are some of the things that during the day contributes to that?
Well, sometimes, a lot of people say, well, I'm up watching my favorite show at night. So sometimes people are up binge watching whatever their favorite show is, or again, sometimes they may have that person that's calling them late at night. Often I have to talk to people about setting boundaries. Right. So sometimes we have to turn, okay, so by 9 o'clock I'm going to bed. So that means I'm not answering any phone calls after 9 unless it's an emergency.
Right.
So sometimes you got to set boundaries in your life, not looking at those emails that are coming through at midnight, waiting and looking at those emails that are coming through the next day. So you have to set boundaries in your life. And
folks should be okay with that. Folks should respect that.
Sure,
I mean, if you're in a close relationship, you should respect that, right? They should,
yes. But sometimes you have to, and we can be guilty because at the end of the day, a lot of us, hate to say no, especially if you're a servant. You hate to say no to people. And so, but sometimes you have to say no. You can say it in a polite way, or, hey, I'm trying something new right now. I'm trying to get more sleep because I'm noticing that I'm not getting enough sleep. So, I won't be answering phone calls after 9. And so sometimes you have to, again, set those boundaries. You can set them gently. But, our phones are so unique.
Or forcefully.
Yes, or forcefully. But our phones are so unique now. We can set our phones to do not disturb. And so, that's a neat thing with technology.
Right. Yeah. So I know your faith is a big part of your life. So as believers, where does faith fit into all of this?
So that's a great question because, again, like I said, I believe you need to pray to God. about what's going on, but then God gives you wisdom to seek the resources. And sometimes the resources are the practitioners, the counselors that are there to help you. But throughout the Bible, when we think about going back to the Bible, medicine and medical care was throughout the Bible. Luke, I believe he was one of those early church leaders that followed. Wasn't he a physician that followed
Yep.
Paul? And then you also have Isaiah. I remember Isaiah created a poultice out of fig that
Right.
he helped put on the bulls that King Hezekiah had, I believe. And then also, what was it? The Good Samaritan. You know, the Good Samaritan was also cleaning the person's wound and helping them. So throughout the Bible, there was healing and there was medicine. People prayed, but then they also did medical things as well. So again, going back to, you wouldn't tell someone not to go to the emergency room if they had a leg injury or had chest pain. So this is no different in seeking out time for your mental health, whether it's setting boundaries because you need more sleep, or making sure that you're hydrating, or making sure that you're drinking enough water, or talking to your partner, not feeling embarrassed that if you're having changes with your hormones, but having those important conversations that you need to have with your providers.
Wow, powerful. I think one of the reasons, well, I know after pastoring for 26 years, one of the reasons that a lot of folk don't really want to talk about mental health in the church, because a lot of times you're criticized for not having faith,
Right.
or not trusting God, right? Because some folk feel like that if you have Jesus, you have everything you need.
Exactly.
You
Exactly.
you don't need to go, if you have, but, and you just said it. I mean, if you're having chest pains, you're going to have Jesus, but you're going to call 911.
Exactly.
And you're not going to say that person has a demon. You're going to call 911. Hey, you're having chest pain, so forth. So I think we should protect our mentals and have the same priority with that.
Yes, there we go. Protect those mentals.
Yeah, that's very important. And we need to, because with what's happening, we need to make sure that we're not so bogged down with stuff and we're so stressed out that we can't carry out the assignment in which God called us to carry out in the earth. I believe that you have a great assignment, whatever your title is irrelevant, but I believe that you have a powerful and a great assignment to carry out in the earth. And God wants you to carry it out with excellence in it, and but at the same time, he wants you to be able to enjoy and not be stressed every day of your life.
Perfectly said.
Yeah. So what would you say tonight to those that's been listening? And if it's just one thing tonight, that one thing, David said, there's one thing I have desired of the Lord. So what is that one thing tonight that you would want to leave with the people tonight? That if there's like one thing that's a priority, what would that one thing be?
Can I say a couple of things?
Yeah. So you might have 3 or 4.
First, I want to say, if you're dealing with hormonal changes, stress, or depression, know that you're not crazy. It's not a sign of weakness if you,
More like a faith.
yes, nor lack of faith. It's not a sign of weakness if you feel like you need to go and seek care or seek treatment. Know that you don't have to suffer in silence, but know that seeking help is powerful. It's a sign of courage.
Wow. So it's okay to have Jesus and a therapist.
Exactly.
Wow. So it's been a very powerful conversation tonight. Anything else you want to share tonight before we leave?
No.
You're good?
I'm good.
Well, listen, we appreciate you tuning in tonight to Advancing the Kingdom podcast. Just really want to have this conversation each month because I think it's very vital in the times that we're in. Just so much happening in the world today. So much is happening in our personal lives. So many things is happening all over the place. And there's a plethora of noise in the earth. So we're going to continue these conversations. I hope you're able to come back next month because we want to continue to talk about mental health. Just once again, it's a powerful conversation, and we need to have these conversations. And we need to, If we need help outside of the church, outside of the altar, it's okay to go out and get help. It's okay to have Jesus and a therapist. Listen, I'm Apostle Matt Tillery. Until next Monday at 7, go and advance the kingdom.
We pray you have been empowered and blessed by this teaching. Join us next week for the Advancing the Kingdom podcast. If you would like to reach us, email us at mltillery@icloud.com.